Welcome, dreamers, learners, and doers. Today we are back with a very interesting topic. I think you'll be intrigued as much as I did. I'm in a very special room and we've got a very special guest. I'll let her introduce herself.
Hi, everybody. My name is Rose Hedges, and I'm the Nursing Research and Innovation Program Manager for Unity Point Health St. Luke's Hospital.
Welcome to our channel.
Thank you.
Thank you so much for allowing us to come and have this talk with you. We see that you've got a big project here, or many big projects that you are doing. Tell us, what do you do?
That's a great question. It's
Yes.
what don't we do here? So we are a fully functioning medical makerspace inside of our hospital. And what that means to me is that we are a physical place where team members can come and experiment on their ideas to safely prototype solutions to patient care challenges or workflow challenges, or sometimes it's just a novel idea that they'd like to bring to life.
Wow, this is good. So any employee can just come.
Yeah, patients too. So it's open to really the Unity Point Health network, if you will. So any team member is able to come in the door and use our space, as well as we encourage our clinicians to bring in patients, or sometimes patients reach out independently.
Wow, this is so beautiful. No, we didn't even know that there is a project like this one. When did you start working on this project?
It's a great question. So I started this work actually in 2016. I was going back to school to get my doctorate in nursing, and I wanted to study the topic of innovation as an engagement tool to help keep nurses excited about their work and retain them at the bedside. I found a little company that spun out of MIT called Maker Health.
Okay.
And they were studying how nurses globally were making things to address patient care challenges. And they partnered with the Robert Wood Johnson Foundation to do a big nationwide study to study the nurses in hospitals across the nation and kind of uncover stealth making is what they called it. So they were studying this, and I found a TED Talk by Anna Young, who made this company, Maker Health, and I knew that I had to work with her. So I reached out to her and I said, I love the work that you're doing, and I would love the opportunity to bring that here. And really the rest is history. So we started in the process of mobile innovation labs. So I had a cart and I would go to different areas of the hospital and I would talk to anybody who would come. What are your ideas to fix patient care challenges or workflow challenges? And we would prototype things. I did that for about 18 months and built a portfolio of projects from people here in our hospital. I was really lucky that we have really great leaders here that supported me and believed in this work and supported us to go to the next level and really making a physical space in our hospital where we can have it always open for people to come and make their ideas reality.
Wow. Yeah, this is really good. No, it's really good and it's so interesting. You've got a lot to tell us.
Yeah.
But it looks like you are self-inspired. Is it? Or I'm misplacing my judgment?
No, you're right. You're right. So yeah, you don't really hear about makerspaces inside of hospitals. We're kind of few and far between. We're one of 3 in the United States that operate the way that we do. Many people will know of innovation programs in different organizations or schools of nursing or medicine, things like that. So I think that self-inspired is a good way maybe to describe it. My mother would tell you that I was always fixing things as a child. I've always been a very curious human, whether I was fixing a process, a thing, or a person, right? I'm a healer. I like to fix things up. And so I just kind of leaned into the things that I really found joy in life. And I would say self-inspired is a good way to kind of put that, how I got involved in this.
Wow. No, this is really good. So dreamers, learners, and doers. You see, you can be a nurse, but besides being a nurse, if you think outside the box, there's a space for you. This hospital is one of the hospitals, only one of the 3 hospitals in the whole country, which created a space for someone who had the same mindset as a nurse. It actually helps. it's actually changing the way I think about nursing, because I always used to think nursing was always bedside nursing. And then now you talking about innovation.
Yeah.
Did you do any extra studies to do this, or did you supplement your studies with something? Tell us, because there are students who probably want to be like you. Can you please tell us your journey?
Yeah. So I started out as a bedside nurse. I had a bachelor's degree working at the bedside, and I actually went back and got my master's degree, and that was in health advocacy. And I used that, not even related to that, but I kind of, I guess, if you will. I worked in informatics for a while, and then when I went back for my doctorate is when I have a DNP in organizational leadership and nursing education, a couple other passions of mine. Not a specific training program, but I really tailored the education to meet things that I was interested in. So because I knew I was interested in innovation and kind of what came before us, and novel things that were coming from nurses, like the Red Cross or like the crash cart, things that nurses created. A lot of times in graduate school, you're able to tailor your specific projects to areas of interest for you. And so that's kind of what I did there. But I would say, as far as working in the makerspace, I work alongside a really great engineer, DJ, and he helps me stay technically safe. So when I say technically safe and clinically safe, having a nursing background, I'm able to keep people clinically safe. I know the clinical side of a project, where the technical side, maybe we're talking about materials or a process. That's when that engineering background kind of comes into play. So together we're really the sweet spot. Being able to bring the knowledge to the table.
Wow. So we have DJ, the engineer.
Yeah.
Engineering is in so many parts, I guess. I don't understand their terms, but we are going to call DJ so that he can explain his education background and what he's also doing in this part of the hospital. But in a nutshell, tell us, what are you doing in your space?
In a nutshell is a hard thing to answer, because we've been open since the fall of 2019. We have over 1,200 projects. So many people will ask me, "What's your favorite project?" They want to get to the bottom of this. Like, what do you like the most? And I could speak to many projects, to adapting a kayak for a kiddo who was paralyzed, to creating 3D printed baby brains for education. But I think with the portfolio as large that is, coming back to the people, the people are what my favorite part is about this space, inspiring others to feel validated in their solutions and help them bring those to the table and be just at the leading edge of medicine, really. Like working in an organization that supports and wants all team members' ideas to be heard, because they feel and know that it's the people that make the organization really go around. So I would say that it's hard for me to say one specific project, but it's when a patient comes in and they're able to impact the way that they receive care, or say a nurse comes in and they create a device that now it goes across a whole patient population. We use it on every patient. The light bulbs and the joy that they get to have, that's what's the most important, I would say, for me, as far as the space.
Wow, 1,200 projects, it's a lot. So when people bring their ideas, do you also work with them, or you work on something and then you come back to them? How does it work?
Yeah.
If someone has an idea out there and they want to come to you.
Yeah, so we help the inventor or the creator make the idea with their own hands. So we're not a drop-off station. So if somebody were to come in and say, "I'd like to make an aneurysm because I want to use it for education with my patients in the ER," I don't know, I just dreamed that up. We would show them the computer software that you would use to make that come to life, and whether we're drawing it or we're adapting an existing file, or maybe we're taking a CT scan and just narrowing down the piece of anatomy that we need. We would help them run 3D printers and stuff like that. So we're giving them new skills as well. So this space is not just a creation station. It's also a professional development opportunity, because you're gaining new skills when you're here. And when you mentioned if I had additional training,
Yes.
On the job for sure. I've learned so
Wow.
much just through experience and learning how to bring these projects to fruition. And that's something that I enjoy being able to give to others as well. Just, a new skill to put in their toolbox.
Wow. No, this is really great. So it's only the two of you, or you have got more staff members, and then you work with the public. Do you have any? Do you allow people from all over the world to come to you, or you are just working in the USA?
We actually have done a lot of international work, but in the capacity of a lot of remote things. We do a lot of remote brainstorming. COVID kind of changed our mindset on that. We did a lot of work with some hospitals in Italy and Spain and brainstorming solutions to challenges that they were having, but we were also having. As far as working with a specific individual, I would say our space is really best suited for people who are coming in from our organization because a lot of the work occurs in kind of micro sessions, right?
Okay.
So you could imagine being a nurse working on the floor and, oh, hey, I have 15 minutes in between my next case. I'm going to run down and work a little bit on my project. Or maybe you dedicate some time after your shift to come in and work on it.
Oh, yes.
So I would say that's the majority of our work that we do. So I'd say that's kind of where we work best.
No, this is very good. Yes, because DLD, Dreamers, Learners, and Doers, they're international. So I had to ask that question because there might be someone who is watching us and they would really love to come up with an idea and bring it to you, and but you had that DLDs, they are also international in as much as they want you to be hands-on as well on your project. Well, we'll take a tour around your space. It's a very big and beautiful space, and enjoy and let our viewers see what you're doing, the projects you're working on, and enjoy. Hopefully DJ will also join us.
Awesome. Thank you.
But thank you so much.
You're welcome.
For this space.
I hope we inspired at least one person to get into innovation.
Oh, yes, that's right. That's the whole point of making this vlog, inspiration, showing people, exposing them to what's out there. Many people don't know that these things, they exist. And your education system, it's I can say open-minded because it allows you, a nurse, to do all this, and your project has been going on for years.
Yeah.
That's really good. We really admire you.
Well, thank you.
All right. Well, viewers, now it's time to see DJ, the engineer. He will tell you, he's just celebrating behind the camera. He will tell you what he studied, what he's doing, and how he also works in this office space. Stay tuned. Don't forget to comment, like, share, and subscribe. Okay. Dreamers, learners, and doers. Have you ever wondered how far you can go in nursing, from your very first class to running your own clinic one day? Well, today I'm breaking down the nursing ladder in the USA in the simplest way possible. Think of it like a video game. You start at level 1, and every time you level up, new doors open. Here we go. The first level, we call it CNA, Certified Nursing Assistant. This is where it all begins. Training takes just a few weeks, and you just get to jump right into the world of healthcare. CNAs help patients with daily needs: bathing, eating, walking, comfort. They are like the heartbeat of every hospital or nursing home, always there when patients need a smile or a helping hand. Other continents or other countries, they call this level the Red Cross certificate level. Level 2, LPN or LVN. the practical nurse. It's about a year long. You take the NCLEX PN exam. LPNs give medication. They take vitals and they work closely with doctors and RNs. RNs, it means registered nurses. They are like the reliable middle players who make sure everything runs smoothly. And the best part, many LPNs bridge to become registered nurses later. Then comes level 3, ADN, Associate Degree in Nursing. This is a 2-year community college program that makes you a registered nurse after passing the NCLEX RN. You can start working right away in hospitals, clinics, or home health. ADNs are the real warriors. Bedside, ER, ICU, caring for patients directly. It's also a smart route for people who want to work while they study towards a bachelor's later. The next level, that is level 4, BSN, which stands for Bachelor of Science in Nursing. It's the golden ticket. It's usually a 4-year degree. But if you already have your RN, you can do an RN to BSN bridge in about a year and a half or to 2 years. With a BSN, doors open beyond bedside care. Leadership, research, education, community health, and even innovation. This is the level when nurses start influencing change, not just following protocols, but improving them. This level 4 usually takes 4 years. But here is the secret that many people don't know. You don't have to spend all 4 years at a big university. Many students first take their prerequisite nursing classes, things like anatomy, microbiology, and psychology, at a community college. Why? Because it's cheaper, more flexible, and smaller class sizes mean you get more support. Then, once you have finished those prereqs, you can transfer straight into a BSN program at a university. That move can save you 1 to 2 years of university tuition because you will only need to focus on your upper level nursing courses once you transfer. So basically, you spend less time and money and still walk away with the exact same BSN degree. And once you have the BSN, that's where the real adventure begins. Well, you are no longer limited to bedside nursing. Now you can lead teams, educate patients, join public health programs, or even step into research and innovation roles. This is where the nurses start changing the system, not just working in it. Next is level 5, MSN, Master of Science in Nursing. Now you can become a nurse practitioner, nurse educator, administrator, or clinical leader. You are no longer just part of the care team. You are helping run it. It's like going from player to coach, mentoring others and shaping healthcare decisions. And then the next level is level 6, doctoral level. You would have doctored the nursing portion of life. And finally, the top of the mountain. There are two main parts: DNP, Doctor of Nursing Practice. This one focuses on real-world practice and innovation. And then there is PhD in Nursing. This one is all about research and teaching. DNPs lead hospital systems and launch quality improvement projects, while PhDs advance the science of nursing, writing, researching, and shaping the policy. So just a quick recap. The nursing ladder in a nutshell. We are starting from the bottom to the top. CNA is the basic caregiver. LPN, practical nurse. And then the ADN is the registered nurse. BSN is a professional and leader. MSN is a specialist or educator or nurse practitioner. Then DNP or PhD is an innovator, researcher, or visionary. No matter where you start, there is always a next step waiting for you. Dreamers, learners, and doers. Whether you are beginning or already in the field of nursing, remember this: nursing isn't just a job, it's a journey. You can start small, grow big, and even end up changing how the healthcare system works. It is your right to dream it, to learn it, and to do it. Let's talk again about the nurse practitioners, or the nurse educators, administrators, or clinical leaders. For you to acquire an MSN, it usually takes you about 2 years. And it's where the world of nursing really starts to open. You know the fun twist about this level of education? In some USA states, nurse practitioners can open and run their own independent clinics, and no doctor required. They have what's called full practice authority. That means they can manage their own patients, just like physicians, especially in primary care or family practice settings. But in other states, nurse practitioners still need to collaborate with or work under a physician's supervision. That is called a restricted or reduced practice state. So it really depends on where you live. States like Arizona, Oregon, and Iowa, they give nurse practitioners full freedom to practice independently, while states like Texas and Florida still require a physician partnership. Either way, nurse practitioners are transforming healthcare. They bring accessible, compassionate, and affordable care directly into the community. They are nurses who didn't just stop at caring. They advanced into curing and leading. Now some people ask, what's the real difference between an LPN and an RN? Well, think of it this way. Both are incredible nurses, but they play on slightly different levels of the same team. An LPN focuses more on hands-on bedside care. They take vital signs, give basic medications, help patients with comfort and hygiene, and report changes to the RN or doctor. An RN, which means registered nurse, on the other hand, has a broader scope and more decision-making power. Registered nurses, they can create care plans, start IVs, give IV medications, perform complex procedures, and educate patients and families. They are also the ones who supervise LPNs and CNAs. So basically, of all the things an RN can do, the LPN can do most and accept the more advanced or critical tasks that require judgment and leadership. The RN's training dives deeper into the assessment, critical thinking, and coordination of care, while the LPN's training focuses more on direct and routine care. Both are essential. Both make a difference. It's just that the RN carries a bigger backpack of responsibilities and opportunities. And lastly, let's talk about one of the biggest questions in nursing. What's the difference between an ADN and a BSN holder? Think of it like this. Both make you a registered nurse. You both sit for the same exam, the NCLEX exams. The only difference is the path and the opportunities after graduation. The ADN or Associate Degree Nursing is usually a 2 to 3 year program offered at a community college. It's faster, it's more affordable, and gets you into the workforce sooner. ADN nurses do almost everything bedside nurses do, giving meds, assessing patients, documenting care, and saving lives every shift. BSN then, it goes deeper and wider. It's usually a 4-year university degree, or shorter if you already took your prerequisites at a community college and transfer in. The BSN doesn't just teach what to do. It teaches why you do it. You learn about leadership, research, public health, and even healthcare innovation. That's why hospitals, especially teaching and magnet hospitals, prefer BSN prepared nurses. They are seen as future leaders, the ones who can manage units, educate others, and even more into advanced practice or administrative roles. Both saves lives, but the BSN opens more doors in the long run. Well, so whether one starts with an ADN or one goes for BSN, you are part of the same mission, healing people one patient at a time. The difference isn't about who is better. It's about which path fits your goals, your timeline, and your season of life. DLDs, I have exhausted every corner of the nursing pathway. Don't forget to comment, like, share, and subscribe.